Hello, I'm Darlene Stromstad, President and CEO of the Mohawk Valley Health System. As we are all aware, we are in the midst of a resurgence of COVID-19. It's frustrating and it creates uncertainty and stress for us all. But I want to reassure you that the Mohawk Valley Health System is here to care for you. We are doing everything we can to protect our patients, our employees, and our community. Today, I want to provide you with an update on all the things we're doing here at the Mohawk Valley Health System and to answer some of your questions. First, let me say how proud I am of our dedicated healthcare workers who continue to care tirelessly for our patients and for our community. Every day, I witness the selfless dedication of our staff. So I say to our staff, you are the real heroes of this pandemic. Yes, I know you're tired. Being on the front line brings additional stress to you and your family. Please know that your leadership team is working hard to provide relief and support. I'd like to address some of the confusing and conflicting messages people are hearing, and I'd like to focus on the facts. Certainly, you've been hearing about safe staffing and PPE, personal protective equipment. Let's start with staffing shortages. Yes, just like hospitals around the country, we are struggling with staffing. You can see on any national news program, there is a nationwide shortage of nurses. This shortage existed even before COVID-19. Last winter, before we'd heard about this coronavirus, there was a national shortage of nurses of 1.2 million nurses. Think about it, a 1.2 million shortage of nurses in the United States. And then you add on to that the increased demand on hospitals due to COVID and the numbers of staff that are out because they've been exposed or have become ill with this dreaded virus. This is a situation that this country has never faced before, and the Mohawk Valley is not immune from this shortage. So we're working hard to recruit not only nurses but other staff like care techs, respiratory techs, lab personnel, housekeepers, and dietary staff. We are not sitting idle. We are aggressively acting to address these challenges. In addition to recruiting, we're implementing a staffing plan for the next 3 weeks that offers increased compensation for nurses who are willing to work extra shifts. We are bringing in agency nurses, travelers, as quickly as we can and are exploring other agency options for care techs and other essential jobs. But that is also a challenge. One of our staffing partners told us they had orders for 18,000 nurses across their market area. So we are reaching out to past employees as well as those who have applied for a job in our organization in the past. We're again contacting nurses who took a layoff and asking them to reconsider. A reminder that all of our staff have long been back from furloughs. And you may recall that one of our unions, NISNA, chose to take a layoff instead of the furlough option. Of those nurses involved, all but about 10 have chose to come back to other nursing positions at MVHS. So we continue to call those 10 and ask them to come back as well. Our HR team is contacting schools and is connecting with businesses where there may have been layoffs to look for workers. And we are bringing in some of our own nursing students during their winter breaks. We are seeking to adjust wages where we are not competitive. We're offering incentives for joining MVHS, and we're identifying other innovative approaches for filling all of the open positions for these critical jobs. We appreciate it when our union supports these midterm actions. We have invited representatives from the nursing union to join us in developing other solutions. We are taking every possible action we can to assure that we have the additional staff to care for the growing number of patients, both COVID-19 and those with other illnesses. This will help to relieve some of the stress on our existing employees. We are committed to doing all that we can. You have my commitment on that. At this time, we have not eliminated elective surgeries and procedures. We saw last spring that delayed care could be risky for people. We assess our situation daily, and if we need to limit non-COVID patients, we'll put into place a decompression strategy that may limit some patient access. And now I'd like to talk about PPE, personal protective equipment. The state of New York requires that all hospitals in the state, including MVHS, have a 90-day supply of PPE. We manage our supplies daily and have our supply available to our employees. Through this diligence and by working with others, to include Oneida County and the Mohawk Valley Hospital Supply Company, we are in a good place with supplies. Much has been said about the N95 respirator mask. These offer the highest level of protection for healthcare workers caring for COVID-19 patients. Last week, we received 20,000 N95 respirators. We will also receive an additional 20,000 N95 masks over the next 10 weeks. That's 40,000 masks. Right now, we have gloves, we have gowns, and we have other equipment. And like I said, we manage this every day. There's a lot of national competition for these supplies. There's also a lot of discussion about hospital capacity. This means having enough beds and staffing to surge up to care for an influx of patients. We also monitor this every day. Sometimes twice a day, we'll review our status to guide us in our decision making. At this moment, we have the capacity to care for our community, and we have a surge plan in place that would increase our bed capacity if needed. Rest assured, we're here and ready to take care of you. These are trying times in healthcare. If ever there were a time when we should all work together, this is it. We need to put aside our own agendas to work collaboratively for the good of this community. Spreading rumors, participating in vitriolic debates, attacking each other. This isn't how we want to behave. So I'm calling on everyone in our organization to join together to solve our issues with a sense of urgency. Talk is not action. We need people to bring their best to support this organization so we can focus on taking care of the patients. We cannot afford to waste any more time or energy on the distraction of unproductive activities. We all agree that there are issues to be addressed. This is not a perfect place. Now it's up to all of us to work together to make change and do what is necessary. So we invite you, I invite everyone to be part of the solution. To the members of our community, we ask you to support our healthcare workers by doing your part. Wear your mask, wash your hands, maintain social distancing, and avoid indoor gatherings. The healthcare workers at MVHS are counting on you to help flatten the curve of COVID-19 cases and decrease hospitalizations. The vaccine is coming, and we're working on a distribution plan which will begin in the next few weeks. We'll follow CDC and state guidelines and start with the most at-risk population and the frontline healthcare workers. It will take months before enough people have been vaccinated for our country to again be safe and for us to resume our former lifestyles. So keep practicing your safe habits. In summary, let me again say how grateful we are to our employees, our healthcare heroes, who are going above and beyond every day to care for our patients. On behalf of the board of directors, our medical staff, and all of the members of the community, our heartfelt thank you for all you're doing. And to our community, your kindness and generosity have helped to keep us fueled these past very difficult months. Likewise, we are here for you. So thank you and stay safe.